2016, I believe. And it's a cool, to hear her story. I love to hear her story. Throughout her journey, she was always so positive, so energetic. Praise God through the whole thing. And so I get to read, to tell her story. But it's interesting because she was in my class, and I taught a cycle class, and she came to my cycle class, and she's like, yeah, my leg's hurting. And she's like, I think I have a stress fracture. Well, it turned out to be something more. So she'll be telling you more about that. So she is a proud native of Odom, Texas, raised by her loving parents, Jana Watley Williams and Trey Williams, alongside her older brother, Trent. Jillian is a lifelong athlete who played one semester of collegiate volleyball at TLU. Her life changed dramatically in 2016, ironically during the week of her 19th birthday, when she was diagnosed with Ewing sarcoma, a rare and aggressive bone cancer. Her treatment included 11 months of chemotherapy and ultimately led to the amputation of her left leg. During her treatment, Jillian recognized the importance of having a future to work toward. She remained focused on her education, completing her degree in professional sales online and graduating just one semester ahead of her original class. That's impressive. Her experience fueled a passion for helping others, leading her into the medical technology field. She began her career with Stryker Orthopedics, specializing in orthopedic oncology and limb salvage replacements. Today, she works at Intuitive, where she trains surgeons in robotic-assisted procedures using the Da Vinci surgical system. Sounds pretty cool. Jillian's resilience and athletic spirit continued to shine after her recovery. She joined the U.S. Women's National Sitting Volleyball Team in 2018, and alongside her teammates won a gold medal at the 2020 Tokyo Paralympic Games. She took time off during the Paris 2024 cycle to raise her family and is now training for the 2028 Games in Los Angeles. In 2020, Jillian married her husband, Kyle Coffey. Together, they are parents to their son, Major, which is running around here.
Chaos.
2-year-old, yeah, and are expecting their second child this winter. The Coffey family lives in Katy, Texas, with their 2 golden doodles, Olive and Lily. And 2 principles she follows. She follows Jeremiah 29:11. Some of y'all might know that verse. For I know the plans I have for you, declares the Lord, plans to prosper you and not to harm you, plans to give you a hope and a future. And then her personal motto, make a difference by being different. So let's welcome Jillian.
Okay, can y'all hear me okay?
Yes.
Everyone? Yeah? I mic'd up, which is very anxiety provoking. When I went to the bathroom, I was like, I really hope I left this thing on mute because that's going to be bad. I am so excited to be here today. I know that we have set aside 45 minutes for me to talk about my story and 15 minutes for Q&A. I will say I probably will not talk for a full 45 minutes because I do want y'all to have the opportunity to ask whatever questions you have, whether it be about my cancer life, my time here at TLU, my career now, how I chose that career. What, age ranges are y'all? Are freshmen, sophomore, junior, seniors, have all of them? Okay. Perfect. So some of y'all probably already have it figured out. Or right? I know. I'm like, age, class. How do we do this? But anyway, yeah, I'm so excited to be here. I like this to be interactive. So if I start getting boring, someone raise their hand and let me know because I will very much appreciate it. I want to see if I can get this clicker thing to work. I don't know which direction. Oh, there we go. There we go. So life before cancer. I grew up like Dr. I keep wanting to say Dikey, but short said, mentioned in a very small town outside of Corpus Christi. Do any of y'all know where Odom is? Yeah, I know some of y'all here are from the South Texas area because I follow y'all on, not follow you on social media, but I see when schools like post about people coming to TLU and things like that. So I always love to see it. I grew up in a farming and ranching family. So my family is 5th generation farmers. And I grew up showing livestock. My dad was the ranching side, my mom was the farming side. When my dad's dad passed away, he said, we are not raising horses. You can do anything else. So I ended on every species of livestock but chickens. So funny thing about this photo, this was in the fall of 2016. It was like December of 2016. 2 weeks before that is when I was told my femur was fractured. I should not be walking, but I was committed to going to Arizona to show livestock. So that is me at the Arizona National showing my last sheep that I've shown. And then that is my volleyball team when I was here at TLU. Y'all might recognize some faces on the photo, but I played a freshman season here at TLU and then was diagnosed the following spring semester with my tumor. So I have a lot of like scientific things in here. I don't know if any of y'all are biology majors or science majors or anything like that, but I'm going to kind of talk through what each of these photos are and what they meant during that time. So does this have a laser? I have a laser, this is fun. So this photo here was actually the first x-ray that I ever had done. I was presenting with extreme knee pain. I was not able to sleep at night. So two things that are very common with bone tumors. I did not know that at the time. I just thought it was normal. I was playing. I was working out way more than I probably should have, and I was not eating the way that I should have. So I went in, saw a doctor. He saw this little bitty shadow right here. So this is my patella, condyles, tibia, fibula. Saw this little shadow that kind of encompassed that side of my bone. And I thank God for him every day, because if it wasn't for him seeing that, we probably would not have gotten my diagnosis as soon as we got it. So Ewing sarcoma is a soft tissue cancer that many times can be in and outside of the bone. So with mine, it was inside the bone. With Ewing sarcoma, a lot of times it's in the chest wall, pelvic area, long bones. So mine was in my femur. So that surgeon that I saw did not like the reading that he got back from the MRI that was taken, and this is that MRI. So this whole white area right here is essentially where my tumor was. And the doctor the radiologist that read it said that he believes it was a non-ossifying fibroma, which is a very common bone cyst in children that are like 12 to 15. And he was like, I do not like that diagnosis. You're 18 years old. This is not normal. I want you to come back every 2 weeks, and I want us to rescan every single time. Oh man, I clicked forward. Okay, so here you can see that shadow has grown. See it from there to there. And that was essentially us watching my tumor grow. So we took a CT scan, and that right there is what my tumor was. So it's very, like I said, a lot of scientific, but I try to break it down as simple as possible. But one of the biggest things that was an identifier for him during that time was bone tumors. When they're in the bone and grow outside and are malignant, they grow what they call fingers. And what it is blood vessels feeding from the inside of the bone to the outside of the bone, giving it the nutrients that the tumor wants. So right there on the edge of my bone, you can see little bitty fingers that were feeding that tumor to the external portion of my bone. Anyone have questions with that? That was a lot. Think about them. Oh, I keep pushing the wrong direction, y'all. Okay, so surgery options. As y'all can see, I chose to amputate my leg, but I did have lots of surgery options, 5 different ones. I had the option to do limb salvage, which was mentioned in my bio, because that's actually what I sold for 4 years. I had the option of above-the-knee amputation, knee fusion, radiation, and rotationplasty. So what limb salvage is where they would have removed the whole knee joint, essentially kind of like a knee replacement, but they take out every portion of the bone midway through the femur, and they put a metal implant in. This is a really good option for patients who are not comfortable with amputating. They don't like the thought of amputating. For me, I'm like, I got 2 of those things, cut it off, we don't need it. But not everyone is that way with it. With that, the risk of it coming back, there's been no studies technically done on it, but the chance of reoccurrence has tended to be higher for people who choose to do limb salvage. I met 2 people before I even met with my surgeon in the first weeks of my diagnosis who had both relapsed and passed away within like 6 months of me being diagnosed. And I was like, yeah, we don't need to keep the leg. Like, we can just amputate it. So that was surgery option number 1. above the knee amputation. That's what I went in for. I was like, I want to have my leg just amputated. And my surgeon asked me what my goals were in the future, and they were to have a family and play volleyball again. She was like, all right, I have a different option for you, which is rotationplasty. So I'll get down there in a second. But knee fusion, pretty much what it is. They fused the knee straight, so I would have had a peg leg, essentially. And then radiation, which leaves the tumor essentially in the body. Chance of it coming back is significantly higher because it stays in the body. And then the bone and secondary cancers are also very common with radiation. So it's like, again, no, don't need that. And then rotationplasty. Has anyone heard of rotationplasty? Some of us? Yeah? Do y'all want to explain what it is? Yeah. Or what you know about it?
You tell us.
I'm quizzing. You raised your hand.
Oh, I've heard of it. I don't know what it is.
Okay. Come on. No, I'll talk it through. So rotationplasty, what it is, they essentially take this, he's like, I'm never raising my hand again. They take the center portion out of your leg, they rotate the bottom half of it 180 degrees and reattach your tibia to your femur, making it one bone. So if y'all have TikTok, it's funny because my video circulates quite often that people have taken from MD Anderson and like voiced over, and then they're like, you know, whenever you can like do a little green screen or whatever and your head pops up and they're like, what the heck is this? That's my foot many times on backwards. So if you see this video ever, it's my leg. But they took 36 centimeters out of the middle portion of my leg, rotated it. I have a plate and 8 screws that fused my 2 bones together. I did not walk for a year. I actually came back to TLU. So my amputation was July of 2016. I came back to TLU in August of 2016. Was supposed to still be on 2 crutches, but like I'm kind of hard-headed and don't like to follow directions. So I came back on 1 crutch, and I had my service dog with me, Olive, which most of the professors here know Olive because she was with me everywhere. Big, white, fluffy, golden doodle. And then about 4 weeks into being here, I fell and broke my tibia on my little leg. So I was back on crutches in my wheelchair, you know, swallowing my pride. Oh my God. Yeah. They asked me if I wanted a microphone, and I said, no, I don't need a microphone. I'll drop it. So anyway, yeah, this was about, this middle photo here was about 7 hours post-op. And then this photo here was 12 hours post-op. So I got in a lot of trouble because I got out of a chair. I got out of my bed when I was supposed to still be in bed. I sat in a chair for, oh, you can see more photos. I was supposed to stay in, there we go. Supposed to stay in my bed for at least 24 hours. I did not. I sat in that chair for 4 hours and ended up having extreme swelling. My leg swelled up to like 70 centimeters around. In medicine, they always talk about centimeters, which is like kind of confusing, but it was huge. And so I was then put on bed rest for almost 2 weeks, getting the swelling to go down while I was inpatient, because the body naturally wants to turn the foot back around, which is wild. So they do what's called vein wrapping, and they put all the veins and the nerves in the inner portion of the thigh. And because the body is the way that the body is, it will sometimes reject it. So because of all the swelling, they had to do a lot of, it's called like Doppler and things like that to check my circulation to make sure my foot wasn't going back the other direction. Yes?
When you got this option in 2016, how common was this?
Not very common. At that time, I was probably like the 150th one in the United States, like not many. My year, there was 6 done at MD Anderson, so I had my surgery at MD Anderson. Since then, there's maybe been 1 or 2 a year at MD Anderson. So we're only to probably about 200 of us. And we're all on a Facebook, not all of us, but most of us are on a Facebook page. So that's how we keep up with each other and ask like rotationplasty questions, because they're not a very common surgical option. So finding prosthetics and things like that can be a little bit challenging. So yeah, not very many of us. Yeah?
Like, what about feeling your foot?
Yeah.
Is that like instant, or like how long did that?
It was instant. It was the craziest thing ever. I could feel everything post-op because they don't disconnect any of the major nerves and blood vessels. So I could move my foot. I wasn't supposed to, but I was like, whoa, look at this foot, it and my surgeon was like, absolutely not, please stop moving it because it will reject. But the only thing that was weird is when I thought I was moving my foot in, which is like what we're used to, my foot kept going out because that was the direction that it was facing, you know. So my dad and I one time got in a really big argument over which direction my foot was going because I wasn't looking at it. I was like, no, it is going in. He's like, no, baby, it's going out. Like, you got it backwards. So it did. That is what took a while for me to get used to. But yeah, good question. So my functional level now. I have had the privilege to travel the world playing volleyball and do way more than I would have ever done with two legs. So I, in 2019, had the opportunity to go to the Pan Am Games, which were in Peru. And we stayed an extra week to be able to hike Peru. We hiked Rainbow Mountain in Machu Picchu, which this picture here is Rainbow Mountain. Which, I don't know if y'all have ever seen Rainbow Mountain, but in photos, it looks way different than what it looks like in person. This is more, it's more muted, like it is in this photo, but in some of the photos, it looks like it's glowing, vibrant. And then there's Machu Picchu there, and then me in one of the Peruvian villages with my blade on, and that is me paddleboarding, doing paddleboarding yoga without my leg on. So I can walk on my foot as if it was a regular foot, and I walk on my other knee. So now being pregnant, I'm not supposed to hop, which is also what I do a lot, but my OB's like, yeah, terrible idea. So I crawl a lot and I don't wear my legs, so I just walk on my little foot as if it's a normal foot, and then my knee, which is funny because Major, my son, has started doing it too, and he's like, I look like mommy, and I'm like, yeah, sure. But my amputation has not limited me one bit. One of the other things whenever I was choosing it was I wanted to be able to chase my child one day. And I knew that if I kept my leg, I could chase my child if I had to, but I had the risk of falling, breaking my endoprosthesis, having a big surgery. So I have learned to run again. It's not very graceful, y'all, but I've learned to run again. And then, like I said, I've hiked and played volleyball all over the world. So I am so grateful for the surgery option that I chose, but like I said in the beginning, I know it's not for everyone. So yeah, I just like to always take that into consideration, because before I worked for Stryker, I was like, who would keep their leg? Like, this is craziness. But now, after I've been able to actually be in the OR with patients, see what that surgery process looks like, it helps me understand a lot more as to why we're attached to the limbs that we have. So where I am today, this is me playing against China in the gold medal match at the Tokyo Olympic and Paralympic Games in 2021. It was technically 2020, but COVID happened, so it's 2021. Sadly, we had to wear masks while we were playing. We were the only country that wore masks because we had 4 teammates test positive for COVID before we even got there. I was not a starter at all. I was third airy. And our starting middles both tested positive for COVID. So 4 of us went to Tokyo while the others were at home trying to figure out when they were going to be able to come to Tokyo based on what the Japanese government was going to allow them to do. And our last teammate flew in 8 hours before our first match. It was crazy. She was our libero, #1 libero in the world. And my coach looked at me while we were trying on, so cool thing about the Olympics and Paralympics is you get to have a uniform fitting essentially, and you get to try on all the gear, and your opening ceremony outfits get fitted and tailored exactly to your build. It's the coolest thing ever. We're standing there, we're so excited, getting everything fitted, and our coach comes in and he pulls me aside and he's like, are you ready to be a starter? I was like, no, but yes. How could I not be ready? So I had the privilege of playing every single game at the Paralympics. My first match, I sat there and cried pretty much the whole first game because I was so overwhelmed. And it wasn't even like regular games because there wasn't any fans there. So I can't imagine what LA is going to be like. And I pray that I am there. And then, like I said in the beginning, I am a gold medalist from that game. So we beat China, the gold medal match. They kicked our butt in pool play. And I went into that gold medal match thinking I did not come and train all this way to get silver. And we had one of our best games ever. It was the coolest feeling ever. There is nothing like standing on the podium watching the American flag being risen and the national anthem being played and 2 other countries standing below you. It's like the wildest feeling ever. So that is one of my hidden secrets now. I don't usually tell, like I was telling Dr. Short about this, I don't tell people that I work with about it. And it's funny because about every 3 months someone's like, I Googled you. And I'm like, one, why are you Googling me? And they're like, and you didn't tell us you're a gold medalist. And I'm like, it's kind of my secret, but now everyone in the OR knows this. But yeah, this here is one of the robots that I get to work with now. So I work for Intuitive Surgical. Does anyone know what Intuitive is? Do anyone know what Da Vinci is? Yeah, one person knows what Da Vinci is. So this here is actually a head and neck course that I put on for MD Anderson Fellows. So we can do base of tongue resections, palate resections for people with mouth cancer and throat cancer. So we had a cadaver lab and bring the robot in, get to teach them in a safe environment that they can do that on. And then I also work with 2 other robots. They're fully controlled by the surgeon, but I train them how to safely use it, and then they get to do the procedures that they want. So after working for Stryker, or when I was working for Stryker, I said I would never work from the hips up, and I said I would never work on anything but bones. And I'm all in the abdominal cavity now and in the mouth, so like it's totally different than what I ever thought I would be doing. Oh no, what did I do? Oh, yeah. Me and this clicker, we're gonna go a long way. But yeah, so I get to train surgeons. I just promoted into a role, actually today was my first day, into urology gynecology specialist. So now I work with urologists and GYNs with specializing in their procedures that they do for patients minimally invasive. So my goal is that we do not have to have any more open surgeries. We can do them minimally invasive. People get out of the hospital a lot faster, recover a lot quicker, less blood loss. They're not on as many pain medicines as they are on some other surgeries. So, yeah. I also do a lot of advocacy work for childhood cancer. So childhood cancer is the leading cause of death by disease in children. And only 4% of governmental funding goes towards childhood cancer research. And so I've had 2 proclamations signed at the Capitol fighting for more funding with childhood cancer at the state level. And then I also have a foundation myself called Live and Leap Foundation. And what we do is we grant needs and dreams to adolescent and young adults with life-threatening illnesses. So similar to Make-A-Wish, but we're ages 18 to 29. And so we get to do the fun stuff, like gotten to do a wedding. I had a patient who was diagnosed his freshman year of college, and we got to kind of like deck his dorm out, build him a computer for college, paid rent for a young lady who was a single mom with breast cancer. So gotten to do a lot with childhood cancer research. A couple people in here to highlight, that's me with no hair. My son thinks it's my husband half the time when he sees me bald, because my husband's bald, so it's kind of entertaining. This right here is my oncologist, Dr. Segalski. He is here in San Antonio, or he's in San Antonio. He is the best person I could ever have in my life. Is one of the people that helped save my life. And the man next to him is Dr. Ani, who's one of the head of pediatric oncology at University Hospital in San Antonio. In research, he's got a really amazing story being diagnosed with lymphoma. When he was in med school, he actually had a heart attack due to the chemo that we receive. And he had just finished his cardiac rotation, and one of his classmates sitting next to him saved his life by doing CPR on him and providing the right care that was needed. So he does a lot of advocacy work too with the post-treatment things that we have to deal with. I have no idea how long I've been talking, so.
45 minutes.
Oh, great, doing good. We're almost at the end, y'all. You're making it. And then this here is another time that we have gone to the Capitol. This guy up here, his name's Michael Scott. He is also a survivor with me, so he gets to travel with me and does advocacy work as well. That's funny. I just said Michael Scott and realized that his name. Yeah. Yeah. And then my biggest blessing yet. So I'm sure most of y'all saw him rolling around in here. We call him our feral raccoon. That is Major. He is 2.5 years old and is pure bliss and chaos at the same time. My husband, Kyle, he's a firefighter in Houston. He actually works with the hazmat team now, which I didn't even know this. This is a bad wife of me, but he'd been a firefighter for 10 years, and he just said that earlier as of August. So I'm like, oops, were we supposed to like celebrate or something? Because I didn't know it had been that long. And then that was me playing this year. I was actually pregnant there, but nobody knew except for us in this little circle. But it was the last competition that I played at this year. And sadly, we got silver. I'm like, dang it, I didn't come back to get silver. But, you know, got to lose some time to humble ourselves. So, and then, of course, he's going to get to be a big brother. So that's him there. But that's really all I have for speech-wise and, like, my life-wise. So I would love to open it up to any questions that you all have. Please do not be shy. Y'all got a while to ask them. I don't know if they can leave early or not, but I'm sure you can. Yeah.
I was just, do you have any advice? Now, I came back, I'm older, I'm 31.
Yeah.
And I just look back on my path, and I should have did college a while back, but I had a bad wreck back in 2020.
Mhm.
It's left me struggling with a traumatic brain injury where just even studying is
Yeah.
a challenge. So I'm just trying to figure out like what will be the best to keep on. I want to at least walk the stage.
Yeah.
That's my goal. Is I want to at least finish this out.
I love that.
Can you summarize the question because you're being recorded?
Oh, it's being recorded. Yes. He, 31, decided to come back to college, was in a car accident or an accident that resulted in a TBI. And so just, I guess, what keeps me going? One, I live by my Bible verse. For I know the plans I have for you declares our Lord, plans to prosper you, not to harm you, plans to give you hope in the future. The future that I have been able to live has been bigger than anything that I could have ever imagined, and it was because I kept pushing. There were hard days, like we were talking about earlier. I'm definitely a very positive person. It's just, I'm very bubbly, very wild personality. But there are hard days, and that is totally okay. And one of my biggest things I've learned is to sit in those days, allow them to happen, and then know that there is something greater on the other side of it. And God has already written our story for us, so we don't have to write it ourselves. So live it, love it. You're going to walk the stage. It's the greatest feeling ever. I graduated during COVID, so then I went back and got my master's, so I was like, I'm going to walk this stage. Like, I'm going to do this. So just keep pushing. Yeah. Yes?
This is gonna sound really weird, but I'm gonna explain why I'm asking.
Nothing's weird. Please, girl.
Because I'm pretty much unassuming. But how do you deal with like people staring? Because my dad got in a real bad oil field accident, and they almost amputated his leg.
Yeah.
So it's very obvious his leg. He's been in and out of a wheelchair from crutches, and he had an X-Fix and all that.
Mhm.
And so every time we go to the store, he's getting out of the stairs, and it's just like mentally, it's like messing with him a little bit.
Yeah. So for me, because I wear a prosthetic now, nobody knows my foot's on backwards. But for a full year, everyone knew that my foot was on backwards because I couldn't wear a prosthetic. It took a while for my leg to heal. People stare out of curiosity many times. I'm a very abrasive person, so when they would stare, I'd be like, hey, do you have any questions? Like, I would love to tell you about my leg. And they're like, oh my God. And I'm like, I don't think it's awkward, but do you feel awkward now? Because, like, you were staring. So I just want to, like, but my biggest, like, for me, it's my way of being able to teach people about childhood cancer. And so that's kind of how the approach that I take it. So I think running towards it versus running away from it is sometimes easier because you kind of just hit the nail on the head. And then you stop noticing people staring. But, yeah.
Name your leg?
Yes, my little leg's name is Lenny. So when I woke up from surgery, I was like, I'm feeling real good. And I was like, I love my new leg, Lenny. And everyone was like, what? I'm like, I don't know. I love it. It's Lenny. And so, like, pretty much everyone in my life, and even not in my life that have, like, read about my story knows Lenny. And it's funny because they'll ask, like, how's Lenny doing? And I'm like, oh, Lenny's doing great. And it also helps my parents too, because they're like, how's your leg? I'm like, well, one's really tired, and then one's really learning what it needs to do with its life. So like, which one are we talking about? So now I refer it to Lenny, but yeah.
And I saw something on the news this morning about AI and how they're using that in childhood cancer. Do you know much about what they're doing there?
I do not. I know there is, of course, lots of research that's like going on through AI. We do a lot with like the robotics side of it too. But I don't know specifically about childhood cancer. But I'm gonna have to look into that because I'm curious.
I saw it on the news this morning.
Yeah. So, how did I get invited onto the USA team? My amputation, like I said, was in July of 2016. The Rio Olympic and Paralympic Games were in 2016 that year. And so there was lots of press about people with amputations. And that was really the first games that the Paralympics were starting to be talked about a lot more. And one of my teammates is actually the centerfold of Sports Illustrated, the one that showed up to our game like 8 hours before we played. And she didn't have her leg on, and someone sent it to me, and it was about 2 weeks before my amputation, and they were going to Rio like a month after my amputation. So I decided to reach out to a couple of my teammates and ask like what the vetting process is to be able to get on the team. And it was videos. I had to like send my coach videos. I had to like do, which is totally wild because it's not the same as like a standing sport or other sports, but sent in videos, did like an interview, and then I went to camp. So we do like, it's like the minor league, it's called A2. So I went to camp with them for 2 camps. My stats were rated, and then I was asked to be on the team. So yeah, kind of an interesting process. It's not like anything else, any other sport. Usually they have like big, like camps where they have all these athletes come in, you wear a number, a penny, and like you practice for 3 days straight, and then the team is selected. Volleyball, it is not that way. We train year-round. We've had the same 20 athletes on our team for about 20 years now. So there's not a lot of turnover in volleyball. Yeah.
How do you like your season at TLU? Are there like any highlights that you remember from it?
Oh my gosh, I loved my season at TLU. It's so funny, like driving on. I have some funny stories of like my volleyball season. My biggest highlight probably was, oh gosh, I'm trying to think. My first tournament was at Austin College, and it was just so cool to like finally be on like the college like court and playing. I was actually an athletic training major as well, so I got to spend a lot of time with other athletes, which I really liked too. And then funny story, not about my season specifically, but just my time here, is I had a pet hamster in my dorm. Probably should not have had a pet hamster in my dorm. And I took her outside with me. Why? I have no idea. I was holding her, and she jumped out of my arms, and she ran away on campus. And my mom was like, and this is why we don't need pet hamsters at college. So yeah. Yeah, it was great. My roommate was traumatized by Chelsea Kemp. Yeah. Any other questions? Yeah.
Why are your noses different color? I'm just asking because I noticed one was.
Oh, that's a great question. Love that. I've had that question a lot. I have no idea. I wasn't quite ready to go fall, and I wasn't quite ready to leave summer. So I just mixed the two. That's my personality, though. It's kind of a little bit of everywhere, if you can't tell.
Did you have friends that shaved their head with you?
So I had like my friends at college. It was all the boys. None of the girls did it because they were like, we ain't shaving our head. But half the boys, I was like, can y'all please grow y'all's hair back? Because y'all do not look good with no hair. But my boyfriend at the time, he shaved his head, and I was like, we can't both be sitting here bald. Like, can you please grow your hair back? And like my family too. My mom was really funny. She was like, do you want me to shave my head? And I was like, please, no, don't do that. She was like, oh, thank God. And I'm like, you weren't what do you mean? Like, did you not really want to? She's like, no, not really. And I'm like, got it, okay. But we did have a wig party. So all my TLU friends went with me to San Antonio. We tried on wigs. It was like a whole event that we did. I didn't wear one wig while I was on treatment, so it was a big waste of money, but it was fun to have that experience. Yeah. Do y'all have questions? Y'all are talking. Oh yeah, but yes.
Okay, it's a little funny, but so like post-rotation plastic surgery,
Mm-hmm.
whenever your foot would itch, would you like reach forward and try to scratch it and then realize it's like behind?
Yeah, like where my foot itched was that is what took my brain a lot longer to grasp onto. But yes, I would. Or I would go to stand, and I'm like, oh, there's nothing there to stand on. I would jump out of bed, and yeah, it was just, it's not funny. It was really what was happening. So, yeah. Yes.
One of the students from the other really wanted to know more about your OB/GYN experience.
Like what I'm doing currently for my job?
Yes.
Well, I'm learning. I'm learning what I'm doing for my job. But as far as what I do maybe, do they want to come over and ask it? Because I'm like, I don't know what they want to know. There's a lot to it. While we're waiting. Oh, yeah.
My friend got his leg amputated. He said that sometimes, you can feel his leg is there and it hurts really bad.
Yeah.
Even though there's no leg. Do you have something like that too? Even though, because you still have something attached there. But
Yeah.
like that as well?
So he was asking about, we call it phantom pain in the amputee world. So one of the perks about rotationplasty is we don't experience phantom pains many of the times because we still have those major nerves. So a lot of times with blunt amputations, they will feel like their foot's still there. They'll get Charlie horses, but there's no way to get the Charlie horse out. They'll get itches, there's no way to scratch it. But with rotationplasty, that's one of the perks of it. I don't know if your friends ever tried this, but there's something called mirror therapy that is supposed to be life-changing. And it's wild. You put a mirror between your legs and you put we'll do this, the leg that you do have, and move your toes, and it kind of tricks your brain of thinking that you have two legs because the reflection of what it looks like. So, yeah. I don't know if it works because I've never done it, but I have had lots of friends have success with it. So, yeah.
I wanted to ask you about your experience with GYN, because my mom's an OB/GYN, and I think it's really cool, when you decide experience.
Yeah, I love that your mom's an OB/GYN. Bless those people, because I don't think I could ever deliver babies. That's terrifying to me. But what made me want to go into the more gynecology space was I watched open surgery be done on female patients for things that could be done minimally invasive. And one of the specific patients that I watched an open procedure on was on, she had ascites, which meant her liver wasn't working, so she was extremely swollen. She has metastatic cancer disease. And they cut her open from pubis to mid-sternum to get the tumor out. And the chance of her recovering from that is slim to none because of where she was at in her staging of cancer. And so I made it a goal now to focus on how do we decrease that. Yes, there are going to be patients that have open procedures based on whatever their anatomy looks like. But for a patient like that, if we can start minimally invasive and succeed minimally invasive, then let's do it. If we can't, then of course we were going to open anyway. But that's what drove me into the field that I'm doing now. Oh, Kyle has a question. Yes, Kyle? That's my husband, y'all.
I see you have a child up there. Was there anything through your cancer journey
Oh.
that told you that you may not have children?
Yes.
Yeah.
Yeah.
About what you might should prep for in case.
Yes. Thanks, Kyle. Thanks for the question. So, when you receive chemo, there is a chance, which also, where is our child? I'm like, speaking of that. When you receive chemotherapy, there is a chance of becoming infertile post-chemo. Again, another blessing about my oncologist that I had. He's very pro fertility treatment prior to receiving chemotherapy. And so I was able to do fertility-sparing treatment, egg retrieval, before starting chemo. By the grace of God, I was diagnosed with premature ovarian insufficiency, which meant that my ovaries were no longer working, so I was in menopause. But this, by the grace of God, portion of it is I was able to get pregnant naturally both times. But there are some foundations that I do work with. One's called Kate's Cause out of MD Anderson. And I know this is kind of like a weird topic to talk about, but if you or someone you know in our age range that is diagnosed, the chances of being diagnosed is like 1 in 4, which is insane for our age range here. Fertility treatment is so impactful to be able to set your future up if having kids isn't even a thought at the time of diagnosis. Because if you do get to that point one day in life, it's very important to have. So, yeah, great question, Kyle. Yeah.
So like with you having like a big toll on your life, like for so fast when you was at Jillian one year and getting, what happened to you, how were you able to like overcome all the challenges and still have the drive for you want to keep on playing volleyball after you might have felt at one time and it might be over? How were you able to go through it?
Yeah, this is going to be very off topic, but I love your hair. I'm sorry, everyone's going to look at you now. I love curly hair. I found other ways that filled my bucket while I was on treatment. So one of the things that I really like to do is sporting clay shooting. So I picked that up really heavy, and I was shooting competitively all over Texas, and that's actually how I found sitting volleyball. Is one guy at the shooting event introduced me into volleyball, or sitting volleyball, because his daughter, she actually came to TLU, Lexi, I don't remember Lexi's last name, but anyway, she played volleyball here too. But finding other things that filled my cup was super important to me, and it made such an impact too whenever I took a step away from the Paralympics and training for the USA team, because I had other things that filled my bucket. I'm not just an athlete. Being an athlete is something that I do. It's not my identity. I'm so many other things. I'm a mom, I'm a wife, I'm a friend, I'm a mentor, I'm a leader. And so identifying things outside of sport alone was really impactful for me, and still is. Because when I found out I was pregnant 2 months after starting training again, it was like, okay, oh well, because I have my life that I still get to live, and I'm not just an athlete. So, yeah.
What was the process like when you were getting the proclamations? Because you had 2 proclamations out there.
Yeah. So my mom is actually one of our she's a state judge, and she put me in touch with our state rep in our local area. And I worked with him on, the importance of childhood cancer, because a lot of it is putting your passion into someone else's hands and influencing them to be just as passionate as you are about it. And thankfully he was. So he was able to invite us to the Capitol and do that twice. So, yeah. Do you have a question?
So before you were a wife and a mom and a Paralympian,
Mm-hmm.
did you go through a period of a pity party? We never saw it.
Yeah.
Because there was loss. There was
Yeah.
loss of the leg, but there was also loss of your college career.
Mm-hmm.
Did you, and if you did, how did you get out of it?
Yeah, I definitely did. I have a great therapist that I meet with. I was meeting with her every 2 weeks. Then we went to once a month, and now it's as needed, which is great. But what was hard for me was actually when I was in treatment. So like I said, I was diagnosed my second semester of my freshman year. It was February 29th, so it was right before midterms. And I was bound determined to take my midterms. Y'all, I don't have no idea why, because I had to drop out that semester. But I was here taking my midterms. And I was good throughout the summer, and then all my friends came back to campus sophomore year. And that is where it was really hard for me, because I was in San Antonio laying in a hospital bed. They were here having fun, posting about it on social media. And so that's when I was really missing out. But I will say I had a great nursing staff with me, and they were really close to my age because I was treated on a pediatric unit. And so we made life exciting at the hospital. I will say when I came back to TLU, it was also really hard. I came back for, like I said, a semester. The hard part of that was they had all been living a whole year of life together that I did not experience with them. So finding new friends and things like that was challenging, but that's where I had Olive, my dog. Like I said, she went with me everywhere. Y'all, this dog, she's so trained, so good, but she loved to bark at things. Still does. And one time she chased a squirrel across campus. She jumped out of my car while I was driving to chase a squirrel across campus. And I came to class with her, and she, like, her gums were all bloody, and I'm like, she just jumped out of my car. Like, we're going to ignore the fact that she's little. She's got some poodle in her. But, yeah, so there was definitely hard times. There still are. Like, I think about the relationships that my friends had that I was with at TLU that kept going, that I missed out on. But I've been able to make so many more friends, and we still keep in touch and things like that. But my therapist is also a lifesaver. I'm very pro therapy. Yeah.
This is very off topic, but how did you and your husband meet?
Oh, I love that. So I dropped a Hydro Flask water bottle. I was living in Oklahoma training, dropped a Hydro Flask water bottle on my finger and broke the end of it. And I was out for like 15 weeks. This stupid thing would not heal. Probably because I broke it, and then I had a full blocking practice, and then it was like a whole thing. And my athletic trainer was his best friend from growing up. And poor guy, he got to hear all about my love life and my college love life, and they're like 7 years older than I am. So he was married, having his first kid, and right at the end of it, Kyle competed in powerlifting. So he went to watch Kyle compete in powerlifting, and he came to tell me all about this guy. And I'm like, how old is he? What's he look like? I wasn't even 21 yet, so I was like, how am I going to tell my dad I'm dating a grown man? Like, he's got a job. This is crazy. And so he gave me his number, and I was like, I'm not going to call him. If he wants to talk, like if he wants to pursue this, he'll call me. He called me that night, and I was like, oh no, this is happening. Like, what are we doing here? So that's how I met him, was through our friend. Yeah. He also didn't know that I wasn't 21 yet, so that was also kind of that was also kind of funny, but yeah. Any other questions?
All right, well, let's give her a round of applause.
Thank y'all for coming. I really appreciate this. This is fun.
Yeah, in case anybody has
Yeah, I was going to say, if y'all don't want to ask in public, y'all can totally come chat. I'm pretty much an open book, so.
Your training, I guess you've got to go up to Oklahoma and stay there for how long?
4 days.
4 days.
Yeah. Yeah, so it's not terrible.